everyone, this is Zara from Dental Profit Machine. Today we have a very special guest that a lot of you might already know. He is a former dentist. He's retired now, and a dental coach and a speaker. And he is the #1 Amazon bestseller of the book, How to Build a Dental Practice of Your Dreams Without Killing Yourself in Less than 60 Days. He's the inventor of Ultimate Patient Experience, a simple to implement patient retention system. Used to build and subsequently he used to build it and sell it for millions of dollars. He is retired now from dentistry, and he coaches dental practice owners with how to improve their dental practice with customer service and patient retention. I'm going to bring him on the show soon, and we're gonna find out more about him. He has done a lot of things in his career, which I can't fit here. So everyone, we've got Dr. David Moffet here. Hi David, can you hear me?
Yeah, Zara, hi.
Hi. So thank you for coming to our show podcast. It's an honor to have you here. So how have you been?
Yeah, good. I'm sorry about this morning. We have we're house sitting at the moment and limited availability, and my wife had 2 calls, so gets very noisy when we're both on calls together, especially for a podcast. So I tried getting it just off the phone, but we had no reception off the phone, so I had to wait for her to finish her 2 calls. But anyway, we're here now.
Yeah, no worries. It happens to me sometimes too, when it's too many things going on. All good. So yeah, so I've already told everyone about you, but let's get into it. And my very first question will be like, I'm actually curious, have you gone to Australia ADX this year?
I missed out on ADX this year. Were you there?
No, I'm in Melbourne, and I just wasn't sure about, quarantine rules and all that, and I don't want to deal with that. So this year I skipped. Hopefully next year.
It was fine for people to travel to. Unfortunately, we had to isolate, so we had to stay home. I was all ready to go and help out on Dental Practice magazine stand, so I missed out on that.
Yeah, I saw Jane's, was it your post or Jane's post? I think she said something that you're in ISO.
Yeah, but got to do what we got to do.
Yeah, definitely. No worries. So you were a dentist, you're retired now, right?
Correct, yeah.
Yeah, but you were a dentist in the past. So tell us a little bit about yourself and how did you get into dentistry in the first place? And then tell us a little bit about your dental practice that you were running and all that, if you'd like to.
Yeah, sure. So I graduated straight from school, from high school into dental school. Did 5 years of university and became a dentist. I was a dentist for 35 years. I had my own practice for 28 of those years, 21 of them as the owner, and then 7 of them working on for the new owners. So 28 years was a long time to be working in one place, and I grew that practice from one dentist with 1 chair to being 3 or 4 dentists with 7 chairs in 2 locations. So it was very successful practice, and I was happy at the time when somebody knocked on my door and said, "Would you like to sell?" I thought, yeah, this is a great opportunity to just realise the asset in the practice and just become an employee in the practice, working on, because I had seen friends end up having difficulty selling their practices. A couple even died, and their practices were unsellable because the owner was gone, and I didn't want that burden for my family. So I wanted to realise the asset in my practice and sold it. So 28 years, a long time in one place. You certainly learn whether your dentistry is good or not, because if it's no good, people come back and tell you. So what we did worked very well, and we built a very successful business.
Cool. So what was your secret?
I guess the secret is that it's not about the dentistry. It's about looking after people and giving them an experience rather than selling dentistry as a commodity. We gave people such an experience that we were their friends, and the dentistry was just secondary. And so the relationships that we had with patients while we were there and even after, it's been we're into our 8th year since we left that practice, and we still are in touch with patients and ex-patients from that practice via social media. People, always commenting on our posts and even reading our dental articles and saying, yep, that's exactly why we kept going to you as a dentist. So it's about customer service primarily, and not really about the dentistry at all.
Yeah, simple, but the magic. It's a simple thing, but it's a magical thing. In business, we're dealing with people after all, whether it's health or in any industry. Business would be about people. It's about people at the end of the day. So very simple thing, but beautiful and magical. So you are doing dental coaching at the moment. What happened? How did you transit from dentistry to coaching dentists? What was your motivation or the goal and all that?
I'd always had a passion for public speaking, and in dentistry, as I built a successful practice, people kept asking me, what were your secrets? What did you do? So my advice was being sought. And a good friend of mine, not a dentist, said, David, you really should give back to the profession and help other dentists to achieve what you've achieved. Don't just take that secret with you. And so as my time started to come to an end after I'd sold my practice and was working in it, I was looking at, helping other dental practices to break through those glass ceilings. A lot of times dentists just hit a glass ceiling and can't work out how to keep going into that next level. Yeah. And so coaching became really something that was quite natural for me. I knew that I'd built a successful practice. I then taught other dentists to do the same, and I realized that the process was quite duplicatable and gave spectacular results to those who were willing to, follow the processes that I had done. It's not rocket science, but like any form of endurance or achievement, sometimes you do have to be disciplined in your approach to that goal that you have.
Yeah, nice, beautiful. So, in what areas do you help dentists, coaching them with their dental practice growth?
Well, the simple thing, Zara, is that dental practices are they're run very badly. They have very few systems. They have very little accountability, and there's a lot of wastage of resources in terms of materials, money, time, and patience. And so when we look at a practice, we look at how can we make the practice operate more efficiently, because it's inefficiencies that also upset customers. Customers hate to have to repeat themselves. They hate to have to wait. They hate to have to say the same thing over and over again to different people all the time. There are no processes in a dental practice, a standard dental practice, that they follow to make the customer feel like they are valued and important and appreciated. And those are the reasons why people leave dental practices. The patients, they feel like they're being taken for granted, and they're just another number. And when we look at helping dental practices to build those relationships so that they are solving problems all the time. People don't ring a dental practice for any other reason than they have a dental problem.
Yep.
Nobody sits at home and says, I wonder what the 10 dentists in my area charge for a clean. I'm going to do a survey just for my own knowledge in case it comes up a Trivial Pursuit. No, that's not why they ring for a price. They ring for a price because they have that problem. They just don't know what else to ask.
Yeah.
And so what we do is we work on the systems on the phone, we work on the customer service systems within the back end of the practice, and we also help the dentist start focusing on looking at the metrics that really matter in terms of helping the practice grow and continually grow.
Yep, I totally agree with that. Having a system, a good system that you just follow that system every time, and a patient doesn't go through different things every time, and it's simple, smooth, proven system. It's very effective for a business, especially if you want to grow the business to the next level. Otherwise, you're just on a hamster wheel. So I totally agree with that. So what sort of dental practices do you work with at the moment?
Well, I love to work with private practice because I believe that private practice in dentistry is the last bastion of free enterprise. And although the corporates are coming into dentistry, still 90% of dental practices are run in a private practice situation.
Yep.
And so the public go to these private practices because they want to have a relationship, to connect with the dentist, with the dental team. It's part of the community where they live or the community where they work, and so I like to work with them. The other thing about corporates is that corporates have their own internal teams for training, and often they don't need my services. So they do have a distinct advantage in the marketplace because of the volume of money they can spend on advertising and marketing. And this is where the internal processes of a dental practice really need to be at the top of their game, because patients will leave if your internal marketing, your customer service is poor. They'll leave and think, well, dentistry is just a commodity and I'm just going to go to a corporate and just get my teeth cleaned for a rebate. And that's what we're up against. So I'm trying to help the small dental practice owner realize what a gift they have in their hand, because a dental degree is a gift. It's an opportunity to create a business that allows you to choose where you live, where you send your kids to school, where you want to retire to, when you want to retire, and what you're going to do in your retirement. And if you don't realize that when you own a dental practice, you may as well just go and work in a hospital and just treat the needy who can't afford dentistry, because you're really wasting the opportunity. You're wasting it for your family, you're wasting it for your employees, you're wasting it for your patients, and you're wasting it for your community who provide services. Remember, a dental practice provides services to florists, stationers, coffee shops, cafes, all around. It's not just an island on its own. A dental practice is part of a community, and you can really give back to your community by having a successful practice.
Yep, they're all connected. So exactly, with a lot of the dentists, when they come to me and they talk to me, and they're so worried with the marketing, that what are we going to do with these corporates that are at the moment on top of everyone else? They're ranking in the top positions and all that, or they're getting all the patients. And I always tell them that they experience, a lot of people, families with kids and all that, if you give them that different experience, they much prefer to come to you. So they're not after, if you want to go to corporate, it's a different experience. It's like feels like they don't care about them. It's all about numbers. But they much prefer a family-friendly dental practice, private practice that treats them differently. They build a different relationship, an actual relationship, rather than, so you still win, and you will mostly win because of that. So don't worry about corporate being your competition, because they're not. They can't compete with you in that regards.
Exactly.
So I totally agree with you on that. So that's a winning point that private dental practices have, that they are a small business and they can build that human-to-human relationship rather than being just corporate and it's all about numbers and pricing. So that's a winning point there. All right. So as a dental coach, similarly, when you talk to so many dentists, you find some common things between all these dentists and common challenges they have. What are the common things that you see when you start working with a dental practice?
Well, The number one thing that I see is either a practice, that's two things. I either see a practice as being micromanaged by a dentist and being choked, or it's not being managed by a dentist, and so it's just a shambles. And somewhere between the two of those things is a practice that runs like a well-oiled machine. And so when we go into a practice, the first thing that we're looking to improve is systems that aren't monitored, like how is the phone answered, what are the responses being given to certain questions. There are only a certain number of questions that people ring and ask at a dental practice, and there is only one result from a phone call at a dental practice, and that is that the patient needs an appointment. And in this day and age, with so much information about dental practices out there, it's got to be assumed that when the phone rings, that person has already done their homework on your dental practice and wants an appointment. Yet so many dental practices don't train for that phone call. They only practice on live phone calls. They don't even practice with each other on role playing on things that should be done. Sporting teams are run better than most businesses, and I would put dental practices in that category of most businesses. Sporting teams have a playbook. They practice before a game, and they have a coach. And dental practices don't have a playbook. They just say, oh, you used to answer the phone where you used to work. Here's our phone. And, of course, what may have worked or may have got you by at somebody else's practice might be lousy in this practice. Practicing before you take the phone call so that you know what you're going to say and making that second nature. It's why football teams don't turn up on the day and say, oh, who are we playing today? We're playing Manly or we're playing Collingwood. No, they've done their homework all week on the weaknesses and where they're going to win the game. And we need to know what phrases we need to use to help get the result of that patient in our appointment book. So that's really important. And who's better to teach than a coach? You know, a dentist is like a mechanic in an auto shop. The mechanic's under the car all day. He doesn't hear how the phone's answered. He doesn't hear how customers are treated because he's got his head under the car all day. Well, dentists are always got their head in somebody's mouth. They don't know what's going on their phones. They don't know what their systems are like. That's why they need a coach, a second set of eyes, a second set of ears to help train those people. So the people who we employ to train our dental front office people on how to answer the phone are people who have worked in successful dental practices. So it's not somebody who's just come from university or thinks they know what to say, but we also listen to the call. So we know what your patients are saying. We know what your staff are saying, and we talk about things. It's like going to a golf pro for a lesson, and he does a video of your swing so he can show you what you did wrong. When we listen, we can hear the recordings and then we can help people get better. Whereas if we just lectured and said, well, when the phone rings, you need to say this and you need to say that, well, that's just a lecture. That just goes in one ear, out the other. So we get good results. There's a lot of wasted opportunity for dental practice success just on how the phones are answered. And even the most seasoned professionals on the phone know that sometimes they get it wrong and they should be getting it right more often than they're getting it wrong.
Yep, there's always room for improvement, even for the masters. Yeah, we're always learning, But I liked your example of, like with dental practice being like a sports team, having the coach and having trainings before going to a match. That's actually was interesting. It's an interesting way of thinking about it, not just in dentistry, in any business or industry. It's good. I really like that one. I'll take a note of that for myself too. It was good. So are all practices able to improve, or this is not for everybody?
Well, any practice has the opportunity to improve. It's just whether the dentist has the strength or the owners have the strength to allow that improvement to happen. We know from what we teach that we have a proven pathway for success, to help practices achieve success. And the only reason that practices don't achieve that success is that they behave themselves off that pathway. Mm-hmm. That pathway works. It worked for me. It worked for dozens of our clients. But what happens is that staff say, oh, I'm not going to do that, or staff sabotage, or the dentist doesn't have the necessary authority that they should to keep the staff on that pathway. Every dental practice can achieve some form of improvement, but it comes down to comfort level as well. Some dentists are just happy not rocking the boat. Others are always, like some of the most successful companies in the world, like I love Chick-fil-A, who make chicken sandwiches in America. They're only open 6 days a week. They're not open on Sundays. They're the most profitable, by twice as profitable as a McDonald's franchise when you buy one. But as soon as they've developed a new system, they come in Monday and they say, all right, how can we improve that? They've got, right, we've done that. How can we get better? Like cricketers, when they get a century, some of them go and get straight out. Others say, I'll take guard again. I'm going to get another century. I'm going to get a double century. And so that's what we want. We want a practice that wants to achieve and improve. And when we find those practices, they're a pleasure to work with, and the results are magnified, multiplied in terms of how good the results they get by just following the system and just doing what needs to be done.
Yep. I guess, that's very important to follow the system that already has worked and proved to produce amazing results multiple times, but sticking to that system and not, just doing something different or adding things to it that are not going to be helpful, it's going to be hard to keep everyone on track to follow the system and stick to it, not just do a little bit of it and then not do the rest. So it's, if you follow the whole thing, you will get the results, but if you don't stick to the system, then it will be hard for you as a dental coach to then the expected results probably would be affected because of that. So what are the top things that stops dental practices from getting better?
Well, I guess complacency. People who say that good enough is good enough, their systems are better than average, but there is still so much more opportunity to go that extra bit. And when we look at a successful practice, we can find in that practice significant opportunity that could still result in a 50% increase in turnover in that practice, simply because they are just doing what they always did, and they're busy, but they're not productive. They're confusing activity with accomplishment. So they're seeing lots of patients, but they're not really doing much. And, often we see a practice where the principal is still doing half to 2/3 of the income, and yet he still has 2 associates and some hygienists as well. That's not really a business. That's just a glorified job with an entourage that supports or doesn't even support, because what we find in those practices is if we took the dentist out, the rest of the practice would be losing money. And we see that when the dentist takes time off, a couple of weeks, a month, the practice doesn't get busier. Those people don't get busier when he's not there, when the principal's not there. They actually say, well, the principal's not here, we're going to even coast even more. So complacency is the big killer of productivity in a dental practice. And I think that when a dentist takes on a coach, they've got to be willing to trust the force and explore all opportunities of growth. Because remember, a coach isn't just somebody who's got some idea. A coach is somebody who has seen results and knows the industry well enough, because they have other clients as well. So they bring a wealth of experience, not just a thought. It's not like getting your mates together and saying, well, I'm thinking of doing this, and you've got 3 mates, well, they give you 3 opinions. A coach will probably have 30 opinions from his own clients, plus he'll have a wealth of industry knowledge as well. So if you hire a coach, best thing to do is, do what the coach says and you'll get a result.
Trusting in the process, trusting.
Exactly.
In the
exactly.
Coach. Yep. Yeah, definitely. I like your example of dentist being like a mechanic and their head being in the car engine, not seeing the rest of things happening. I mean, it's a good thing to hire a coach so they can look into other things that you're missing out and finding the opportunities that are there, and you're just leaving so much opportunity on the table because there is only so much one person or one dentist can do, or business dentist owner that if they want to get more freedom, not working in their business the whole week and weekends maybe. So it would be good to hire a coach to see those opportunities, to give them the system, put the team and trainings in place and all that. It will be a great thing to do. I myself get so many coaches all the time just to see the improvements that can be made, the opportunities, and just go to next level. Without coaches, it's really, coach takes you where you want to go from where you are. So amazing. Thank you so much. If someone want to contact you to get some help from you, or if they have they know they have those opportunities, the opportunities are for everyone, everywhere. If they want to contact you to learn more and just to get in touch with you, how can they do that?
Well, I'm fairly visible on social media in Facebook, LinkedIn, Instagram, Pinterest, Twitter. If my name is spelled as it is on this interview, Moffet, Dr. David Moffet. And you can also look me up on my website, theultimatepatientexperience.com. You can contact me via email, david@theupe.com, theupe.com, or just reach out to me on Facebook Messenger or LinkedIn and send me a message. I'm happy to chat and organise a Zoom meeting just to discuss the possibilities. Zara, often what we find is that somebody will come to me with a problem and it's like Shrek, we have to peel back the layers of the onion sometimes, and we find that the problem is something completely different down here, and then we've got to zigzag our way back up to remedy what is on the surface the problem, whereas really the problem is a deep down
exactly
issue. One practice that we started working with, said that it was going fine, but he said he had, he was booked out 4 months in advance. Well, what we found is that not only is he booked out 4 months in advance, but he squeezes people in all the time, and so nobody in that practice gets anything really in the way of service because there's this constant running late from squeezing people in, and so there's an attrition on that end, and an expectation that things are just going to be patched and see how we go. So the end result is kind of a little bit blurry. So we're looking at all sorts of things that can affect a dental practice. It's nice to be able to put the magnifying glass on and really help dentists to create that practice of their dreams.
Beautiful. Yep, definitely. Sometimes they come to you with a problem, and as you said, when you dig deeper, the actual problem, the root cause is something else. It's really, that's the fun part of finding out the actual problem, then and you can solve it. So great. I will put your information, Dr. David Moffet's information in the at the top, probably, if you're watching the video. If it's a podcast, again, in the description. And we will be on the video too as you were speaking. It was a great honor to have you on the show, Dr. David. Thank you so much. And we'll see you around Facebook and social media. You're so active. I sometimes watch your videos and learn from you. Thank you for doing that, and have a lovely day.
Thanks, Sarah. Thanks for having me on your show.
No worries. Thank you.